Do you suffer with back pain, lower back pain, numbness and tingling, sciatica, loss or diminish of function? Well, you may unfortunately have a nerve or nerves that are being stretched, compressed, and or irritated. Hi, I'm Dr. Kevin here at Bowie Chiropractic, showing you ways that you unfortunately may be suffering from a nerve or nerves that are being stretched, compressed, and or irritated. Now, last time we chimed in, we saw the side view here of the skeleton. Again, the side view, I should say the spine, and the curvatures there that are designed to absorb and dissipate stress. Curvature is working like a spring in order to absorb and dissipate the stress. What is the stress again? Could be chemical, mental, or structural in nature. But let's just talk about gravitational forces for now. So gravitational forces from above, but then reactive forces from below create stress upon the spine. And you can see the curvatures there again are designed to absorb and dissipate that stress. Now, last time we discussed more about the facet joint on the posterior or back side of the spine. That's there in order to allow us to have movement. 3 planes, of course: flexion, extension, rotation, and lateral bending side to side. But what about the other side, the disc? Let's go ahead and show you that again up close. Here again is a close-up image of the lower section or part of the lower back known as the lumbar spine. Again, you can see here the posterior aspect. We have the joint, most commonly said or known or mentioned as a facet joint. Now, there is cartilage between the joint too. I just want to point that out as well. But on the other side of the hole, you see this material here. This is known as a disc. Now, when the curvature of the spine takes on so much pressure and has a difficult time dissipating that energy, we have a built-in shock absorber. And that shock absorber, again, is the disc. Now, over time, wear and tear, changes in patterns of the function of the spine can give us less space between the vertebrae and unfortunately cause shrinkage of this hole that the nerve exits, therefore allowing a nerve to become stretched, compressed, and or irritated. Let me show you a view of a disc that it looks more of what a stress disc. Here again is a representation of the lower back, the lumbar spine. Due to forces upon the back over time, the disc is known to thin. And in this representation, this shows the disc not only thinning, but possibly bulging, or even more severe as far as like a herniation. That again would affect the size of this hole that the nerve exits, and then this nerve here represents the irritation that can happen from the diminished size of the hole. Again, nerves have a way of getting stretched, compressed, or irritated that can lead to your suffering of your back, giving you symptoms of back pain, lower back pain, numbness and tingling, sciatica, loss or diminish of function. Chiropractic is a conservative form of care, helping you to improve your alignment, restore function, and reduce and or eliminate the inflammation that stresses the nerves that are being stretched, compressed, and or irritated to unfortunately give you those symptoms that we described earlier. Hopefully, helping you get back to all the things that you need, love, and want to do. For more information, check out my website, bowiechiropractic.com.